Hi there, and thank you for joining me. My name is Dr. Autumn Burnette, and I'm an allergist located in Washington, D.C. I would like to tell you about one of my patients with severe asthma and why I chose to prescribe TEZSPIRE, tezepelumab-ekko. TEZSPIRE, tezepelumab-ekko, is approved as an add-on maintenance treatment for adult and pediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. It is important to know that TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab or its excipients. Reactions, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. We'll cover additional safety information throughout the course of this video. In two pivotal studies enrolling a broad all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathway study and 56% in the Navigator study compared to placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils ranging from 0 to less than 300 cells per microliter. Reductions in exacerbations across a range of phenotypic profiles and biomarker levels were observed in patients taking TEZSPIRE. In a post-hoc pooled analysis of Pathway and Navigator, fewer exacerbations were observed in patients receiving TEZSPIRE versus placebo, regardless of baseline blood eosinophil count, fractional exhaled nitric oxide level, or allergic status. Since this was a post-hoc analysis, these results are descriptive only. TEZSPIRE provided a rapid and sustained improvement in lung function. Treatment with TEZSPIRE improved FEV1 by 230 mL over baseline at 52 weeks. Moreover, 70% of the lung function improvement was achieved at 2 weeks. Please note that TEZSPIRE is not a rescue medication. It is important to note that corticosteroids should not be abruptly discontinued. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. After learning about the TEZSPIRE clinical data, there was a patient in my practice who I thought of immediately as somebody who could be appropriate for TEZSPIRE. I would like to tell you about a very bright and energetic woman named Kristen. Kristen is 35 years old, and she has a busy career in education, which she loves. Kristen is proactive about her health and is passionate about all topics related to diet, exercise, and overall wellness. She likes having an active lifestyle and tries to exercise routinely. Kristen was diagnosed with severe asthma in her late 20s, and up until a few months ago, she was getting by on a high-dose ICS LABA with occasional symptoms that she managed with her rescue inhaler. A few months ago, something changed for Kristen. She came down with a non-COVID-19 respiratory infection. Her asthma symptoms progressively worsened as a result of the infection, such that over the following couple of months, she experienced daily episodes of wheezing and frequent exacerbations that required trips to the emergency department, IV corticosteroids in the emergency department, and oral corticosteroids at home. Every time Kristen's physician would try to taper her oral steroids, her wheezing would increase, and she would find herself back in the emergency room with another asthma exacerbation. Kristen was ultimately placed on daily maintenance oral corticosteroids, in addition to her inhaled medications, which was very scary for her. Kristen was eventually referred to my practice to see if I could develop an asthma management plan that could help to reduce her asthma exacerbations and improve her asthma control. I tried several additional add-on medications, including a long-acting muscarinic antagonist and leukotriene receptor antagonist that stabilized her enough to allow me to be able to perform a complete clinical evaluation. Her laboratory workup revealed a total IgE level of 110 international units per ml and a blood eosinophil count of 200 cells per microliter. Allergy testing was largely negative, with some weak positive signals to dust mites and tree pollen. Her lung function was sharply reduced, with a percent predicted FEV1 of 55% with 14% reversibility, and her ACT score was 10 out of 25. In addition to severe asthma, she reported occasional mild rhinitis. My main priority for Kristen was to regain better control of her asthma, with the hope that she could go back to focusing on her busy career and not feel as limited by her severe asthma. After a full clinical evaluation and ruling out other potential confounders and comorbidities, I was certain she had severe asthma and that I needed to develop an asthma treatment plan designed to address her clinical history and needs. Knowing that TSLP is released from the airway epithelium at the top of the inflammatory cascade in response to asthma triggers, I recommended to Kristen that we add TEZSPIRE. I remember showing Kristen a diagram that explained how triggers can interact with the airway epithelium and how blocking TSLP can impact multiple downstream inflammatory pathways. Even though the mechanism of action in asthma has not been definitively established, Kristen is interested in the science and she likes to know how things work. We reviewed the various treatment options available and our treatment goals. Together, we made the decision to add TEZSPIRE. I explained that her individual results may differ from what was observed in the clinical trials. Kristen and I discussed the safety profile information that I stated previously, the potential risks and benefits, and the most common adverse events associated with TEZSPIRE in the clinical trials, which included pharyngitis, joint pain, and back pain. I encourage Kristen to read the patient information available at tezspire.com. Lastly, I explained that she would come to the office every 4 weeks to receive TEZSPIRE by subcutaneous injection. Kristen was started on TEZSPIRE, and thus far, she reports fewer asthma symptoms. To date, she hasn't experienced any additional asthma exacerbations requiring oral corticosteroids. While it is still early in her treatment, we remain optimistic about the potential for her to have fewer exacerbations and better asthma symptom control. I look forward to seeing her back in the office soon. Thank you for listening to my TEZSPIRE moment. I have just shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I encourage you to review the full prescribing information for TEZSPIRE, including patient information at tezspirehcp.com, or you can call 888-TEZSPIRE. That's 888-897-7473.